cervical spinal injury.
Yes, because you can't make, well, roll back again, okay? Roll back again. Okay, how about airway? How do I get to it? How about breathing? How do I get to it? How do I do an assessment for there? It's a must. It's a must. The interesting thing is, you don't find this as much. Most of us will say, what happens if you're hanging on your roof and you just were eating, you know, your toast and the butter's on your fingertips and you're sliding down, the ladder fell, and lightning strikes, and this happens. But fortunately, those things don't happen in that chronology. You'll find people this way, but 90-something% will always be in a decent position to work with. And you don't get a lot of cervical spine injuries. You just don't see them, fortunately. We're well designed as human beings. We're fortunate we don't see them. We treat for them as if they're always there, and so you don't exacerbate the problem. Or, so remember also, you can have a fractured cervical spine and have no symptoms. You know, you can break a bone right in place and not know it and move about for a while, then eventually it's still sore and you go in 2 days later. So that problem holds. So we're very conservative. We treat everything, whether it exists or doesn't exist, hoping it doesn't exist.
Now we're going to talk about common types of injuries that you're going to see after a disaster, an earthquake in particular. One of the simplest ones you'll see is a contusion. That's a fancy name for a bruise. The treatment for contusions, if they're large, that would be direct pressure and an ice bag in a small area. Now, the next injury you're going to see in order of severity is abrasions. These are usually superficial. They rarely produce bleeding, but if they're large, you can ooze. Okay, and again, direct pressure will help that. When you are covering an abrasion, it's best to put a non-stick dressing over it. Because if you don't, the dressing is going to dry to it, and then when you pull it off, you'll cause more bleeding. A way to avoid that, if you have nothing else, and you're just using a dry dressing, is to moisten the dressing before you take it off, and then it comes off easier. Then we go on to lacerations and avulsions. An avulsion is a laceration where it's not just a cut, but a whole piece of skin has been pulled away. Either there's a flap or it's taken off totally. A lot of people, when they cut their fingers, you know, when they're making food, will cut away a whole chunk. That's an avulsion. Now, the treatment for this kind of injury, avulsions or lacerations where there's bleeding, is direct pressure and elevation. Okay? Just drill that into your brains, pressure and elevation. Now, venous bleeding, blood that occurs from veins, is easy to control. The walls are easily compressed, and when you let go of them, there's not much pressure behind them, and so the bleeding usually doesn't start up again because a clot has formed and it's not dislodged easily. When you have arterial bleeding, that's when you see that squirting blood. With each pulsation of the heart, there's a squirt of blood. That's arterial bleeding. The walls of an artery are thicker, so they're harder to compress, and there's a higher blood pressure behind them. So if a clot forms and stops the bleeding and you take pressure off, that higher blood pressure is more likely to dislodge the clot. So you have to hold pressure on arteries longer than you would on venous bleeding. Whoops.
Take it in the center, directly over the wound. Okay. We're going to be, and latest things I've learned from years past, so you go over different
and then the knot goes directly over the wound, too.
You want to, if you can, go all the way around, and we do. Direct pressure.
More pressure, more leverage if you put the knot directly over the wound.
Remember, you're controlling bleeding. If you take the dressing over the wound and you hold it tightly, if you release your hand, there's no longer pressure on the dressing, so it's not a pressure dressing. If you tie the knot opposite the injury, now there's pressure like my hand was here. If I tied it on the far side, the pressure would be on the uninjured part, and therefore there'd be less collapsing of the blood vessel and less pressure on the wound, so it would bleed longer, or if the bleeding stopped, it would cause a larger discoloration, et cetera, et cetera, et cetera. So tie it off here, and you don't have to make a bow, you can just tie a double overhand knot so it stays.
Okay, like this? Is it too tight?
No.
Anyone know the difference between a strain and a sprain? Okay. A strain is a pulled muscle. Okay. A sprain is an injury to a joint where tendons and ligaments are injured. It's a more serious injury. If it occurs in your ankle without an x-ray, you can't tell if there's a fracture or just a sprain. You can get the same amount of swelling and discoloration as you would with a fracture. The symptoms that you would see with a fracture, and you can also see this with sprains, so that's why you treat them all like fractures, are pain and tenderness, okay? Swelling and discoloration if there's bleeding into the tissue, deformity, of course, and grating when the bone ends are moving against each other. It's an awful sound. Also shortening. You particularly would see that if someone falls and fractures a hip. The leg would be shortened and externally rotated. It's actually shorter, one leg shorter than the other. We see that a lot in the emergency room, and right away we know it's a fractured hip. The treatment for fractures or any other injury you might consider might be a fracture would be immobilization. That's the first thing. You don't want those bone ends to move and cause more tissue damage and pain. Don't attempt realignment in the field, okay? Just immobilize by splinting. Fractured toes, what we usually do for those is tape them to the next toe over. Okay, there's not a whole lot you can do for them. Sometimes keeping them in a shoe or a boot helps, but there could be swelling, and then you would want to take that shoe or boot off. For an ankle, you need to splint the foot and the knee so that the ankle doesn't move at all. For the hips, you would splint the legs together, pad them in between, and then tie the legs together. When you have a pelvis fracture, you really can't splint that, but you need to keep the person lying down. Don't let them sit up, don't let them walk. There are two types of fractures that you often see a large amount of bleeding with. It's a femur fracture. The femur is the large bone in the upper part of the leg. And a pelvic fracture. You get a lot of bleeding with those. So people who have those kind of fractures or who you suspect have those kind of fractures, you should treat them for shock right away, even though they're not exhibiting the signs yet. You know, elevate their feet, keep them warm, etc. Something that would give you a clue that there might be a pelvic fracture is when you press on the bones of the pelvis from the front and the side and you get pain. Or if someone's passing blood in the urine, that would be another symptom. Now burns, there are first, second, and third degree burns. First degree burns are like a bad sunburn, very painful, not too life-threatening. Second degree burns is when you actually get blistering, okay? You don't want to puncture those blisters. There's more chance of infection if you open the skin like that. You just cover them with a dry, sterile dressing. If the area of the burn is small, you can use cool water compresses, not ice. Ice causes further tissue damage. Just cool water. But if the area of the burn is large, you don't want to do that because you can very easily make the patient hypothermic. They get cold very quickly. Their body temperature drops from the wet all over them. People with burns have trouble with hypothermia to begin with because their skin is broken and over a large area, and they lose a lot of fluid through the broken skin, through the burns. Third degree burns are the most serious. They involve deeper tissue structures, nerves included. Those are not painful because of the destruction of nerves. However, you don't just see third degree burns. You see a combination of first, second, and third usually. So anyone that's has third degree burns is going to be in pain because they also usually have first and second degree. Infection, like I said, our hands are the worst culprits to spread infection. And so you need to wash between each person that you assess. That's hard to do out there with no water. Another thing you might put in your first aid kit is some kind of antiseptic hand wipes. Or even just if you're washing with soap and water in a bucket, someone pouring the water over you. But again, if you're conserving water, that's difficult. Alcohol too, I mean, although it doesn't really kill bacteria, any kind of washing and cleansing of the hands is better than none at all. And just because you wear gloves does not mean you don't have to wash your hands, okay? You change your gloves between people and you wash your hands too. Okay. If you don't have gloves, use some kind of barrier, a paper bag, a newspaper, saran wrap, aluminum foil, something.